Thank you very much. As we get gathered here today, I'd just like to again thank members of the media for being here today and putting out accurate information all day long, and I truly appreciate that. I'm surrounded by folks from my administration, State Representative China Tyler, City Councilor Anissa Sabi George, members of the Public Health Commission, Bob Luz from the Mass Restaurant Association, many of my cabinet members, in case we have any questions that need answered. This continues to be a very rapidly evolving situation, and you play a vital role in getting the current and accurate information out to all our residents. Today, I'm going to talk more about the plan for the closing of the Boston Public Schools to students. I'll address issues around bars and restaurants. But first, I have an announcement that I want to make. Effectively today, we are declaring a public health emergency in the city of Boston. And the reason why we have one in the state, we have one in the country, and I'll explain this to everyone now. The work to make this decision began last week as part of our planning to support students who are out of school, but also goes beyond the larger situation at hand. Declaring a public health emergency will enable us in the city to deploy all our resources and personnel necessary to meet the needs at any moment. It will authorize us to issue additional directives as different situations develop. It will facilitate coordination across city agencies, including the Boston Public Health Commission. Just as important, it will increase cooperation and coordination with Boston's hospitals and healthcare providers. And it will assist us in seeking additional resources and supports from the state and the federal government. We make this decision to bolster our response to the many impacts that are underway, and also gives us greater ability to respond to emerging developments, such as the likelihood of community transmission in the city of Boston. We're experiencing a public health emergency in the city of Boston, and we need to activate every resource at our disposal. In one important example, the declaration will enable the Boston Public Schools to quickly implement plans to support students and families while schools are closed. They will be able to get services in place without going through the usual procurement process, and I want to say more about what those plans are now for our schools. As we announced on Friday, the Boston Public Schools will be closed to students as of this Tuesday, March 17th, until Monday, March 27th. If need be, and we can end the emergency, we'll go back to school sooner if we have to. If we can safely reopen our schools, we will do that. Schools will be open tomorrow to allow students to gather their belongings, families to collect medications, and teachers to share learning materials. Buses have been cleaned and disinfected and will run on normal schedules. There are two exceptions to tomorrow's opening for Boston Public Schools. The Elliott School campuses in the North End remain closed after a non-student member of the community tested positive last week. And the McKinley School in the South End will also not be open tomorrow. A non-student member of the McKinley community is currently being tested for COVID-19. Out of caution, we are not going to open any of these three McKinley buildings on Monday. The students and the staff and the families have been notified. If the person being tested comes back negative, we'll make time for the students to gather their belongings and materials when appropriate. If the student comes back negative, we will not have students go back into the building, and we will follow up with the next steps. The plan to support all our students during this time has two main areas of focus. First, making food available to children who rely on free meals we serve in our schools. As I mentioned, Friday, 72% of the Boston Public School students qualified for economically disadvantaged. And in fact, we offer free lunches and breakfasts to every student who walk through our school doors. We're committed to feeding our students throughout this period. Starting Tuesday, families can pick up a variety of packaged meal options at dozens of locations across Boston every day from 8:30 to 11. They have been notified where those locations are. And you can also access that website, boston.gov/corona, so that people can find out more information. I want to be clear, no child in the city of Boston will not be provided a meal if they want one. Boston Public Schools will be sharing those locations, and we're going to continue to update parents as we move forward. And more food access will become available through city agencies and nonprofit partners, and we're coordinating services right now with all of our nonprofit partners who have been doing incredible work. The second main focus of Boston Public School Plan is continued student learning outside of school facilities. Schools will be sharing printed learning materials tomorrow for students' use at home. Those materials will also be at the food access shelter site, so if parents don't get them tomorrow, they'll be able to get them when they on Tuesday, Wednesday, when they go and pick up free lunches and breakfasts. Materials will also be made available online through Google Classroom. Every student already has a Boston Public School Google account, and these online tools are already at use in many of our schools. We understand that home access to devices and to internet is an issue for many of our students and their families. We are working with the internet providers right now on free and low-cost service. We're also going to provide a Chromebook to take home for every single student that needs one. Details on distribution are going to be available in the coming days. The superintendent has been working on that plan with her team over the last 48 hours. We know that families of English language learners and students in special ed programs have particular needs. BPS team will be meeting online when possible with families, students, and with special needs to ensure the continuity of learning to support their IEPs. This is our obligation, and we take this very seriously. For students nearing graduation, we will work to ensure they have access to AP and SAT materials, as well as other college and career exams. And for students at risk of dropping out, Boston Public Schools will be working with its Re-Engagement Center on measures to ensure students remain engaged in the coming weeks ahead. We're also encouraging students and families to use materials, create daily routines, and as much as possible to avoid lost time of learning to keep our students positively engaged. The information that we're putting out there is going to do this. We also need to be aware that childcare needs that these steps present to families, and the fact that many providers themselves are having to close temporarily. We're in conversations right now with the City Hall, many people here, with child care providers and employers to assess that level of need, and we'll be working together on plans moving forward. Obviously, this remains an evolving situation on many fronts. We're dealing with every issue that confronts us as residents. We know it's a lot, but please trust us. We are working on them, and we will continue to communicate any guidance that we can to address them. One issue that we have new guidelines for and regulations for ready, and we're announcing them right now, are for our bars, restaurants, and clubs. Based on what we saw Saturday, I directed our licensing board to be proactive about preventing large gatherings. At least 14 bars and restaurants in South Boston agreed to close their bars and doors today. I want to thank them for being responsive. Moving forward, we're imposing these regulations on restaurants, bar rooms, and clubs. They're going to be required to reduce capacity to 50%, which means they're going to have to remove tables and chairs to reflect the reducing capacity, to follow the guidelines on social distancing, and allow no lines to form outside the establishments. Closing times as of now will be 11 p.m., and the violations and violators of this will be shut down for automatically 30 days. This applies to anyone with a CV license. An example of that is coffee shops and pizza shops, as well as large establishments. But this does not apply to delivery or takeout or drive-through services. Those can operate through normal hours of operation. We're working also to support our small businesses, so we want to be able to, if people want to get a meal and go out, or get a meal and take out, they'll be able to do that to keep our service workers employed. We are lifting up regulations so establishments can serve food in takeout. So we're basically, in all intents and purposes, allowing every single establishment that serves food in the city of Boston to have takeout. Even if you don't have a license today, you'll have the ability to do that tomorrow. We're encouraging use of delivery service for businesses that currently do not have a delivery service. Our Office of Small Business is ready to help. You simply have to call 311, and our office is ready to work with you on that. In addition, beer gardens will be shut down until the public health crisis is over. None of them have opened, which means they will not open until this crisis is over. More information is also available on the website of the Inspectional Services Department, so any questions that people might have, in businesses in particular, go to the Inspectional Services website. I also have to send a strong message to anyone who is thinking about going out and being in big crowds. This isn't about you. This is about your fellow Bostonians. It's about your grandmothers and grandparents. It's about your neighbors who are sick. It's about children in your business with asthma, in your buildings that have asthma. The tradition of St. Patrick's Day celebrates is a community that survived hardship because of social solidarity. That's what we need right now, social solidarity. This is a time of shared sacrifice, and I know firsthand that we are capable of that here in the city of Boston. The bottom line is that social distancing is not a vague, wishful strategy. It's backed by science and data. What we do in our city over the next week or two will make big impacts on the local trajectory of this outbreak and our hospital's ability to handle it. It will save lives. Our numbers of cases in Boston went up to 29 as of today, and 138 cases in the state. We're expecting that number will grow, and we're preparing accordingly for that. We have a citywide public health emergency in place, along with similar in state and federal declarations. We also remain in constant contact with our state and federal authorities and our medical providers here in the city of Boston. We remain in the service of the people of Boston. Our Age Strong Commission is working with our seniors in our senior buildings and the private buildings and service providers. We have an agreement in place banning evictions while this emergency goes on in the city of Boston. We're coordinating with nonprofit organizations on food access to the residents of our city. City Hall remains open, but will continue to impose travel restrictions for city employees and limit on city-hosted events. We're working with private organizations to do the same. If you do experience symptoms such as fever, coughing, or shortness of breath, please isolate yourself and call ahead before going to the ER or a healthcare provider. We're asking you not to call 911 for testing, only for emergencies. Call 311 to connect to the mayor's hotline, and we can get you the most up-to-date information that we have. The city and the people of the city are rising to meet this challenge, and I want to say thank you for that. I want to thank everyone who's participating in good hygiene and social distancing. And I urge everyone to keep it up. Keep washing your hands, sanitizing your hands, cleaning surfaces, cover your mouth and your nose when you cough. Avoid contact with large crowds, avoid contact with crowds. Please remember what social distancing involves. It includes avoiding any type of crowds of any kind, keeping a distance at least 6 feet from any other people when you're out and about. Remember, this is not a snow day or a time for visiting with friends. What we hear loud and clear from the public health experts is that this week is critical for flattening the curve. I'll say that again. This week is critical for flattening the curve. I know it's difficult to keep it up, but please, we need people to know that you are making a difference to keep our numbers down. Because of these steps, we can slow the spread of this virus. It's vitally important that we listen to the public health officials. I also want to ask people, don't listen to rumors. If you're not getting the information from one of the news stations or the papers, it's all rumors. We'll have a greater capacity in our hospitals to treat those in need if we're able to keep the numbers down. And we'll be able to protect lives of our elderly and medically vulnerable residents. The more seriously we take this situation now, the sooner life in our city can go back to normal. The vast majority of our city is showing that we care about each other, and I urge everyone to be part of that. And to those feeling isolated or afraid, especially our seniors and families with medical or fragile children, I want to let you know that you're not alone. There are many dedicated public servants in this building that have been spending almost 24 hours a day over the last week working to make sure to keep you safe. We want you to know that we're doing everything we can to keep all the residents of Boston safe. You are at the front of our minds all of the time, and we're doing everything we can to protect you. I want to encourage everyone to reach out to a senior that you know, a resident with disabilities, and a family member with medically fragile children, by phone, by text, by fax, by FaceTime, or Skype. Fax is a thing of yesterday. We want you to make sure you touch base with them, check in with them to see how they're doing, ask them if they need anything. When you bring it to them, just knock on the door, drop it off, and let them bring it in the house. It's the best way to keep them all safe. We want to continue to protect all of those vulnerable folks through social distancing, but we also want them to know that they're not alone and that we care about them and we love them. Keeping our distance is an act of human solidarity right now. It's about serving others while looking out for each other, and especially those who are vulnerable. I want us to remind people of that. The knowledge that we are in this together will sustain us through very difficult times. I want to thank you, and I'll take some questions. Special services are going to be out there. Our police are going to be out there. And we've notified all the bars and restaurants, and the association is going to notify people as well. So right now, they all have the information.
Normally, you would be marching in the St. Patrick's Day parade. This is way different than that. How do you hope to be there next year? And what's kind of is there any remedy for some of the businesses that are having to close and aren't being able to, provide their services and make money on one of their most important days of the year?
Well, I think, right now, the federal government is working on not a stimulus package, but a package that's sitting down. The state's going to be working on something. The governor mentioned today he's going to be filing legislation at the state. I think on the businesses that are losing business, that will be answered in the days to come. But I think right now, my number one priority is keeping people safe and really stressing social distancing and big, large gatherings shouldn't be happening. I think as many businesses that can let people work from home, I think that's important for us to do. We want to make sure everything we can to keep people safe. That we're at that stage right now.
Are there going to be any penalties for the restaurants that may have ignored that 250-person limit last night and over the weekend?
If any violations that we have, we will act accordingly. But as of right now, anyone who ignores our orders will get a 30-day suspension. Yes and no. The surprise, I think the thing that surprised me, a lot of young people, and they should be very much aware of what's going on here, and really for their own safety and other folks' safety, they should act responsibly. I understand St. Patrick's Day, and I was talking to somebody earlier today, if I was 18, 19, 20, when 21, 22, 23, we'd want to be out there. Not in the bars at 18, 19, 20, but, I think it's theirs. They have to act responsibly. They're adults. They want to be treated as adults. They have to act as adults. And right now, acting as adults is being very careful and looking out for your fellow citizens.
Will this remote learning be counted as actual school time? And if not, will students have to make, how and when will students make up the school?
Well, I think first and foremost, it's not going to be counted per se as a school year. We're working with the state to find out exactly what happens with this. I think we can't answer those questions right now. We don't know how long that schools will be out. I'm expecting the schools that cancel school for 2 weeks will be extending that in 2 weeks. I hope they're not, but I'm expecting they're going to be.
Mayor, in terms of the school meal plan and just the plan to get food to kids, could you say a little bit more about how that's going to work, and especially what families should sort of think about if they're trying to plan for accessing those meals, especially if there's working parents?
Yeah, I think that's one of the situations. One of the concerns I have is about working parents and who's going to be watching their kids, and that's something that parents are trying to figure out. That's why we announced it on Friday night to kind of give them a few days. It's not a lot of time, but this is kind of a unique situation that we're in here today with the coronavirus. The plan for food distribution is a pretty simple plan. Parents will know exactly in their neighborhood where to go. So, for example, if you go to school in Dorchester and you live in High Park, you'll be picking food up in your neighborhood of High Park. You won't be picking food up in Dorchester. So we're breaking it down by geographic area.
Opening up any large-scale testing sites?
I wish we could. That's not an answer I can answer right now. I think the question is access to these tests, but the city is ready to open up any location. We're exploring areas in the city that we can make available to our healthcare professionals and to the state. I think that's the one area that I think is people are losing their patience a little bit and concerned about not having enough tests. And I think that, and I have not been critical of the federal government, nor this is the time to be critical per se publicly, but I think we have to get these tests down. And I think Boston's not the only city in America that feels this way. These tests have to come down because people that want to take them should have access to them.
What about hourly employees? Are they going to be paid, city hourly employees?
As far as all city employees,
Sick time?
as far as which
Ones who are not full-time permanent people.
you're talking private or public? Public, they'll be covered. Well,
Hear about healthcare workers catching the virus. Are we confident that there's enough protective equipment to keep healthcare workers apart?
Well, that right now that's still a rumor, I think. So before I don't want to verify something that's not a rumor, but certainly I think that our Public Health Commission is working with the hospitals on any materials they need that we might have or we can gather for them. We're going to work on that. I think that's a question you have to ask the hospitals.
What about MCAS testing? Or students worried about graduating?
Cancel. It's no answer on that yet by the state, but I'm expecting. My recommendation is we have to cancel MCAS testing. We can't have MCAS testing. Our kids can't take it at home, and this isn't the right time. Young people, the stress, what young people are going through now, and families are going through the stress. We don't need to be worrying about MCAS right now. There can be another day for MCAS tests, in my opinion. That's something that's a fluid situation, and we're working on that as well. I mean, unfortunately, a lot of our seniors. I was talking to a parent today. That his daughter's a senior, and I mean that's all still unanswered. And we're going to try and get that information to our young people as soon as possible, because they have their own worries about college next year and about graduation and sports being canceled and all that. And we're going to be working with them all along to try and help them with that.
Any idea of budgeting costs for this?
No, I'm not even concerned about that right now. I think right now it's about making sure that we have the proper plans in place for all of the vulnerable populations in our city, and we have a plan across the board. I mean, we will obviously answer those questions later on, but right now we're not even looking at that.
Is there any other concerns about students getting the virus at those two schools that you mentioned, or do you feel that you have it pretty well contained?
I think we'll get more information out to you tomorrow. We're waiting for a test back from the non-student at the McKinley. We'll get that information. As soon as we get it, we're going to get out to the school community, out to everyone. We're just out of caution. We just don't want to open the school tomorrow. Well, I'll tell you one thing. We had a cabinet meeting this morning. I am grateful for the team that the city of Boston has, and to the residents of the city of Boston. I want to tell them they should be very proud of the team that we've had. Many of the folks behind me and the people that are in this building have just stepped up to the plate. They're not talking about their own personal situation. They want to make sure that the plans are out there. Our job is to make sure that we give information and get as much information to the public as possible. And I want the residents of Boston to know that how proud they should be of city employees and the way that they've handled this situation, all the way from our public safety personnel to the custodians. It's been amazing to watch.
What kind of economic impact do you expect from all the college students?
This economic impact is going to be devastating, in my opinion, and I think that as long as the federal government in the state and the cities across America stay on top of it and address this crisis immediately, that when we get to the other side of this concern, this healthcare crisis, that we have everything in place to get the economy up and running right away. So it's not just the college students leaving. It's literally, I mean, today's a Sunday in Boston. I'm looking out behind the cameras here, and I see 3 people. On a normal Sunday, there'd be hundreds of people walking around here. So thank you for that.
Thank you very much.
Thank you.